Today, we are embarking on a journey that is not just relaxing but also rewarding. Namaste, I am Dr. Jatin Nandlal Walia, working in the field of sports medicine for the last more than 30 years, and I am here to share my experiences with you all. The topic today is sports recovery. But before I speak on sports recovery, I would like to tell you what are the benefits of working with it, and I would like to introduce myself. This just expresses that sports medicine and homeopathy has gone all across the country, not just in a specific region, all across various types of sports, not in a specific sport, all across all scientific literature, not just with homeopathy or allied sciences. Yes, homeopathy has impressed one and all. Homeopathy has expressed that yes, it has a potential to help the Indian sportspersons. It has been more than 2 decades, or rather more than 2.5 decades, since I have been advocating that sports medicine can grow beyond spray and ice. Obviously, it has grown by leaps and bounds. Sports medicine is a science which is growing on daily basis. Sports medicine is a science which is growing not just vertically, also laterally. When I meant that sports medicine can grow beyond spray and ice, I did mean a little bit about therapeutics. When I speak about therapeutics, it is obvious that being a homeopath, I will speak about my science, that is homeopathy. It was my conviction then, now and later and always that homeopathy has a great to offer to sports medicine. Hence, if you check, whenever I have been speaking to the media, they have been kind enough to accept the suggestion that sports medicine and homeopathy can go together, and that homeopathy has a great deal to offer in the field of sports medicine. If you see my next interview, it says homeopathy offers a way out for dopers. I do not mean anything which is illegal, which is unethical for any sports person. First, I am a human being, then I am a doctor, and then I am a homeopath. All these 3 combined makes me understand the responsibility I have towards my sports person, towards my state, towards the game, and towards my country, that dope obviously is a no-no, and a safe natural alternative which is neither detected, which does not cause distress, and which can also offer the benefits in its own manner, is the science of homeopathy. It is more than 15 years ago, or maybe a little more, that I got an opportunity to work with the super talented athletes of Northeast, and there was a great challenge of a language barrier, challenge of a cultural barrier, challenge of introducing sports medicine, especially homeopathy. The challenge was met not with resistance, but was met with acceptance. Not just the athletes, even the management, even the coaches, even the support staff wanted to understand the new science for them of homeopathy, new not as a science, new as related to sports medicine. There homeopathy has given excellent results. In the Northeast, homeopathy has proved these medicines can help those players achieve a podium finish, be safe, do not get doped, are not distressed, and yet can emerge winners. The 5th Asian Football Confederation Medical Conference was a great platform for me to express my subject to the very elite athletes who had converged from all across the globe, and they were appreciative of the fact that there is an alternative to the science that they are already working with. They were now introduced to the science of homeopathy. They do now recognize that homeopathy is not just a science for injuries, but homeopathy can help sports in various aspects like injuries, especially chronic injuries, pains, DOMS, that is delayed onset of muscle soreness, in recovery process, in massage therapy, in psychology, and above all as a performance enhancer. All this without the fear, without the risk of either being caught doping or being detected either in the body fluids or in the medicine itself. That does not mean that you are trying to do something wrong or something illegal or something unethical and hiding it. You are doing something which is neither with this, we are doing something which neither you are doing something which neither harms this athlete nor is unethical nor gives anybody an undue advantage. All it does is enhance the athlete's powers and help the athlete progress towards the podium. Like I have repeatedly commented, no medicine in the world is a substitute to hard work, coaching, talent, discipline, diet, nutrition, supplements, etc. The medicines act in a very minimal manner, and all these factors combined together can help the sportsperson reach the podium. But this Asian Football Confederation Medical Conference was an eye-opener for the world to wake up to the science of homeopathy, especially in the field of sports medicine. Now that we have introduced each other, let's start on the topic for which I am here to discuss with you. The topic is scientific holistic recovery in sports. So when we speak of recovery in sports, we talk of 4 topics. 1. Theoretical discussion, role of pranayam, JNV recovery program and management of homeopathic therapeutics. This discussion now is going to be about a theoretical discussion, and this may not happen to you, hopefully. So when we talk of theoretical discussion, we are going to divide it into the various parts. 1. What is recovery? 2. Theory of recovery. 3. Physiological effect of exercise. 4. Types of recovery. 5. Assessment of recovery. And 6. Holistic scientific recovery. Now, which is the road of recovery that you would like to take? What is normal life or to is a shortcut? Obviously, it is no choice, it is obvious. We want a scientific road to recovery, not with artificial supplements which are dangerous. So, what is recovery? Physiological and psychological processes that help an athlete restore their body and mind to pre-exercise states after intense physical activity is recovery. So, do you agree with this? Well, not really fully. The physiological and psychological processes help in repairing the tissue damage, replenishing energy stores, reducing fatigue, facilitating enhanced performance and minimizing the risk of injury. Remember, mark the words, minimizing the risk of injury, not preventive risk of injury. So, from a scientific recovery, we want to aim towards a holistic scientific recovery, and that will happen with homeopathy. So, when I spoke about the first definition of recovery, we need to modify that definition. Athletes need adequate time to recuperate from the training and playing. The body adaptation to the stress of intense workout and playing is only during rest. Remember, it is not during the exertion that the body will recover or adapt to the stress. This happens only and only during the rest periods. The athlete's stress is not just physical, but mental, social, emotional, psychological, etc. Thus, the rest needs to be on all aspects. This time and the therapy required is very subjective and very individualistic. I am repeating the definition of recovery, which we are going to relate quite often. The athlete needs time to recover in improvement in flexibility and restriction of movement, functional strength, pain and inflammation, neuromuscular cord control, speed, power, agility and endurance, and cognitive functions. The aim of recovery is to be match fit holistic recovery, enabling the athlete to peak performance for the next tournament or the next match. The physiological effect of exercise is exercise increases demand in physical, metabolic, respiratory and cardiovascular efforts. It stimulates the sympathetic nervous system, which is responsible for the fight and flight. It is responsible by increasing the heart rate, the blood pressure, hormone release and blood flow to the muscles. Another physiological effect of exercise is on the release of hormones like cortisol, dopamine, insulin, epinephrine, endorphins, norepinephrine, growth hormone, testosterone and adrenocorticotrophic hormones. This sums up physiological exercise effects of the exercise. This sums up the physiological effects of exercise. You can see that it is affecting the whole body everywhere, the musculature, the nervous system, the endocrine system, the cardiovascular system, the respiratory system, everywhere around. So, we were discussing the all round effect, physiological effects of exercise. Just a recap, it increases the heart rate and the blood flow. By increasing the blood, you are introducing more nutrients to the muscle part. 2, it induces hormone release. There are certain hormones which help to perform better. 3, it increases the respiratory rate. 4, it increases the production of metabolic waste lactic acid built up, etc. 5. It temporarily suspension of immune system response. 6. It increases physical stress, muscle contraction and micro muscle tear. This is a micro muscle tear which will need a recovery process, which will need antioxidants, which will help to cure this micro muscle tears. Next, there is heavy sweating and temperature regulation. Sweating leads to evaporation, which will help to regulate the temperature. Next is water and electrolyte depletion. That is why an athlete is repeatedly asked to consume to rehydrate himself scientifically. Next, there is energy consumption and fatigue. And last, there is increase in neurological activity, enhances focus, response time and mental clarity. So, these are the overall effects of the physiological effects of exercise. Just to bring back the memory, physiological and psychological processes that help recovery and offer the following benefits are: 1. Repair of tissue damage and of the micro muscle tear. 2. Replenish energy stores. 3. Decrease muscle fatigue, soreness and muscle pain. 5. Facilitate enhanced performance. Next, minimize risk of injuries. Aim is not just scientific recovery, but a complete holistic scientific recovery. 7. Scientific recovery is not an overnight process. And last, role of homeopathy cannot be overemphasized. Just a recap, this is already spoken, this is a slide that has to be added. I have been speaking on cryotherapy. I think a little of cryotherapy is in order now. What is cryotherapy? It uses ice cold applications or cold chambers to reduce tissue temperature. 2. It decreases pain and inflammation, especially after intense training or an intense competitive game. 3. It helps in muscle spasm. And 4. It accelerates recovery. Types of cryotherapy: 1. Ice packs and ice towels is a common method for localized cooling. 2. Ice bath or cold water is a more extensive cooling method that can help overall recovery process. And 3. Whole body cryotherapy involves exposing the body to extremely cold air for a very short, calculated, scientifically proven period of time. The benefits: it minimizes risk of injury by reducing inflammation and promotes faster recovery. 2. It improves speed of recovery from intense training sessions, and it reduces muscle soreness and pains after exercise. What does research say? It is worth reading that cryotherapy research suggests scientific evidence supporting effectiveness is mixed. Some suggest it helps to enhance recovery and decrease pain and inflammation. More research is needed to determine the optimum methods and duration of cryotherapy for different types of injuries and athletes. Remember, cryotherapy is not a cure-all. Its excessive use of cryotherapy can potentially lead to frostbite or tissue damage. The benefits of cryotherapy vary depending on the type of injury, the individual athlete and the method of application. I would like to share a method of relaxation of which I am not just fond of, but of which I have complete faith in, because it has shown the results that is expected out of this therapy. This is, some call it the Jacobson technique, some call it the progressive muscle relaxation, and there is nothing that can be called about it. All that I can call it, it is an effective way of relaxing the muscles. In this process, you ask this athlete or the athletes or the team to lie down on the grass or in a clear place. The place has to be cool, not be exposed to the harsh sun, and there should be shade on it. Once the athlete has lied down, ensure that the shoes, the socks are removed, the clothing is relaxed, and the athlete lies on the grass comfortably. He closes his eyes and slowly and surely and in a tone which is very pleasing, either a trainer or the coach or an expert can slowly, gradually start relaxing the muscles with verbal prompts. You start with the toes, you start with the ankles, you go to the feet, you go to the calves, you go to the knee, you go to the thighs, you go to the back of the thighs, you go to the groins. That way you progress to the head, and you allow the brain to settle down and relax. This is a therapy which has been known over years to help relax the muscles, relax the mind. It takes a good 10 to 12 to 15 minutes, but these 15 minutes are worth it because the relaxation that it can offer is a great step towards the recovery process. And this relaxation is not just physical, it is physical, mental, emotional and soulful, as your athlete is lying down there in absolute bliss, considering that his body is now becoming light and that his body is now going to gear up for a very good and a very positive recovery process. Now that we understand what the body is going through physiologically, the body recovers with the activation of parasympathetic nervous system and not sympathetic nervous system, as parasympathetic nervous system controls the body ability to relax. It helps the body to maintain daily functions while it is at rest. So, the health benefits of exercise that we saw in that slide was better cognitive function, better flexibility and mobility, improves cardiovascular health, progressively increases VO2 max, enhances insulin sensitivity and glycemic index, elevates mood, reduces risk of cancer and increases bone mineral density. Some of the physiological and psychological processes which help are repairing of the tissue damage, because every time the muscle is exerting, there is a micro muscle tear or some muscle damage which need to be repaired. Replenishing energy stores like glycogen, because you are exerting or exercising or using energy to exercise. 3, because of this there is a muscle fatigue and this needs to be reduced, otherwise the pain will remain, there will be soreness and there will be restriction of movement. 4, it facilitates enhanced performance. If you have performed well today, if you need to perform as well tomorrow, you need the full recovery of psychology and the physiology. Then because of this, it minimizes the risk of injury, does not prevent risk of injury. There is no such word of preventing an injury, because injury is part and parcel of any sport. It can at best help in minimizing the risk of injury, which is a great advantage to the sports person. AIM is not just scientific recovery, but AIM is complete holistic scientific recovery. Remember these words, the AIM is a complete holistic scientific recovery, not just a scientific recovery. Scientific recovery is not an overnight process. It needs rest, it needs time, it needs holistic scientific approach, all of which is very subjective and a hallmark of the science of homeopathy. That is why the role of homeopathy in helping in the sports recovery cannot be undermined. Now that we know the health benefits of exercise, let us also understand the muscle groups that are giving us the health benefits. Let us give them some credit too. So, there are basically 3 types of muscle fibers and their roles I am going to discuss in this aspect now. 1 is a slow twitch muscle fiber, 2 is type 2A fibers and 3 is type 2B fibers. These are the 3 types of muscle fibers which are playing a great role, affecting the effectivity that is expected out of an exercise schedule. So, discuss these 3 types of muscle fibers. 1, slow twitch muscle fiber. These are abundant mitochondria and myoglobin with abundant vascular supply. 2 are predominant in postural muscles providing low force, and 3, they do not fatigue easily, that is why they can remain active for a longer period of time. Second is type 2A fibers. These are known as fast twitch oxidative fibers. They are used for power activities, example weightlifting with repetitions. They do not fatigue easily, that is why you can see a weightlifter or a boxer or a game in which there is a limited period of time, they can go on for a longer period of time, because they have developed their type 2A fibers better than the other fibers. And 3 is type 2B fibers. They are known as fast twitch glycolytic fibers. They are used for high intensity short duration exercises. They fatigue rapidly, that is why a high intensity exercise, they will exercise for a short period of time, they will get fatigue, but they need to do the recovery process in which that fatigue disappears, in which the pain disappears, the inflammation disappears, they can come back on the field for the next game and for the next game for the next game. This is very important in competitive sports, when you realize that an athlete has to compete in a day twice or thrice. How to plan the fiber, the recovery of these muscle fibers is a very scientific aspect, and which along with science is required the science of homeopathy. Generally, you have three types of recovery processes. One is an active recovery process, two is a passive recovery process, and three is long term recovery process. The recovery can be active, can be passive, can be long term like we saw. An active recovery can be achieved with slow jogging, with swimming, with yoga, recreational games, cycling, etc. It helps in removing metabolic waste, relieving muscle soreness, fatigue, and improves flexibility and energy balance. Passive recovery can be achieved with sleep, with relaxation, with rest, with meditation, with massage, with a contrast bath, with compression garments, and it helps to reduce muscle fatigue, risk of overuse injuries, supports tissue repair, enhances immune system, supports the replenishing of the energy levels, helps mental rest, and helps to have superior performance. Long term recovery can be achieved with a combination of rest, active recovery, massage, stretching, diet, rehydration. Also we can add multivitamins, antioxidants, etc., cryotherapy, pranayam, asanas, compression garments, and recreational sports. A long term recovery will help to prevent burnout, overtraining, helps to adapt to stress, contributes to peak performance, and has to be, like I said earlier, has to be part of the seasonal training. It cannot be sporadic. So how do you assess whether an athlete has recovered or not? Is there any subjective assessment? Yes. One is a subjective pain assessment by the athlete himself or herself. That is very subjective because he has to write or she has to write his own assessment of the pain relief or muscle fatigue. But there are certain aspects in which it can be quantified. So self report, that activity of a log diary is very important. The two or three aspects which will quantify recovery process is: 1. Counter movement jump performance, 2. Heart rate recovery, and 3. Orthostatic heart recovery. Other important assessments include neuromuscular function, biomechanical or immunological assessment, quality and quantity of sleep, and a feel good factor. So what is counter movement jump performance? It is a vertical jump that measures the neuromuscular performance, and the CMG is used to: 1. Monitor sports performance, 2. Assess neuromuscular fatigue, 3. Evaluate training program, 4. Monitor interlimb asymmetries, 5. Assess lower body mechanical capacities, especially of the hamstring, the quadriceps, and of the calves, hips, and the glutes. Now that you understood what is a counter movement jump performance, also known as a CMJ performance, and its advantages, let us understand how to do this test. 1. Stand with feet apart, approximately 1 to 1.5 feet apart, not too far, not too close also, so that you can jump very comfortably. 2. Keep your arms on your hips. There should be no arm swinging. It definitely affects the results of this whole test. So be very careful that the arms are firmly on your hip joints. 3. Flex your hips and knees to lower the body, because if you are going to jump, you need to flex first. So once you flex the knees and the hips, you squat to a pre-decided depth, because again when you are going to jump high, you need to go low a little bit. Remember, a lion, he takes the first step back to really jump to the prey. Then jump as high as possible. Now a small practical hint is: take a piece of stick-on paper and jump and be near to a wall when you are jumping. The stick-on paper you can stick on the wall when you are jumping as high as possible. So you have an indication of how high you are jumped. It is important to understand to aim to land in the same area, because otherwise the result of this test may vary. Now a practical idea will be to use 3 different colors of the stick-on paper when you are using the 3 different jumps. Like, repeat this jump 3 times to take an average, and use the standard formula for assessment. So to recap this: stand with the feet apart, keep your hands on your hips, flex the hips and the knees to lower the body, quickly squat to a pre-decided depth, jump as high as possible with a stick-on paper in your hand, stick the stick-on paper to the wall, aim to land in the same area, repeat it 3 times to take the average, repeat, when you are repeating the 3 times, try and use 3 different colors of the stick on paper and use the standard formula for assessment. How do I do it? You stand with the feet apart, flex the hips and the knees to lower the body, and at a predetermined position, quickly sweat to a pre-decided depth, jump as high as possible and try to land in the same area. Repeat the same 3 times, take the average and use the standard formula for assessment. And what is the standard formula? For a trained male athlete, the average jump height should be 24 to 28 inches, and a trained female athlete, it is 20 to 24 inches. Same for an untrained male athlete or an untrained male, generally it is 16 to 20 inches, and untrained females it is 12 to 16 inches. You can see the difference here, how trained athlete or a male or a female can increase the counter movement jump performance. What is heart rate recovery? It is how quickly your heart returns to normalcy after you stop exercising. It is determined using a heart rate at the end of your workout and 1 minute later. This calculation is a measure of your physical fitness and other indication of your heart health. How to check it? Check the heart rate immediately after hard physical exercise. For example, it is 180 beats per minute. Then totally rest for a minute. Check the heart rate again after 1 minute. For example, it is 160 beats per minute. Your 1 minute recovery rate is hence 180 beats per minute minus 160 beats per minute is equal to 20 beats per minute. A good heart rate recovery after rest for 1 minute is around 18 beats per minute or higher. Our target of the athlete is to reach this or better this. So, the third one was orthostatic heart recovery. It is when the systolic blood pressure falls by more than 20 mmHg, the diastolic blood pressure falls by more than 10 mmHg, or the pulse rises by more than 20 beats per minute within 3 minutes of standing. Let us see how it has been done. So, measure the blood pressure and pulse rate immediately on waking up, but without getting out of the bed. Second, after measuring this, make the athlete stand for about 1 minute, then measure the blood pressure and pulse rate again. The difference between the resting pulse rate and standing pulse rate for 1 minute is the orthostatic heart rate. The orthostatic heart rate normally and healthy is 7 to 10 beats per minute, and is a very good indicator to assess the recovery time. It is a very simple mechanism. Everybody now has a smartwatch. Your athlete can do it on his own, and depending upon this orthostatic heart rate, you can review the training schedule, plan when to give the rest, plan when to get the recovery program, and see to it that your athlete can gain peak performance by getting full scientific recovery. A caution: check all the physiological aspects while assessing the orthostatic heart rate. We were constantly speaking about holistic recovery, complete recovery. Recovery is not just physical, psycho or physiological. So, let us come to that topic. Complete holistic recovery, enabling the athlete to be match fit, does not just of the body and the mind. It includes the psyche, the feel good factor, the emotions, the competitive eagerness, hunger to win, zeal to perform to the optimum after every playing moment. Now, how does one attain this? The complete harmony of body, of the mind, emotions, psyche, soul, etc., and of the physique of the athlete is dependent on homeopathy. This is a very complete chart which expresses how a complete harmony can happen with the advantage of homeopathy. We all understand and we all have studied that homeopathy is the only science which mandatorily takes into consideration the psyche, the personality and the symptoms of the patient while arriving at a prescription. Now that we have understood the theoretical aspect of sports recovery, let us do a little recap, a little summary, so that it sticks in our memory and we can use it to help the sports person play to his optimum and the country win more medals. Now that we understood the physiological and psychological process that happens during recovery, that is repairing of the tissue damage, replenishing energy stores, reducing fatigue, facilitating enhanced performance and minimizing the risk of injury, do you think that this is scientific holistic recovery that we are aiming at? Do we feel that with this recovery process the athlete can go back to the field and perform to his optimum for the next match and the next match and the next match? Or do you think that something else more to be done to this? Do you think This is the final scientific recovery program. We need to add something to this, because this is missing the very vital factor of psychology, of emotions, of the soul, of his desire, of his hunger to win, and of his zeal to perform to the optimum, because these aspects do play a vital role in either the athlete not performing to his optimum, or even the athlete can reduce his playing time. This affects not only the player, but the team and the bench strength, and this affects the coach as a task at his hand if your player is not fully recovered from the previous game. So, understanding these types of recovery, of active recovery, passive recovery and long term recovery, let us go a little depth into this to understand what is happening. For active recovery, it involves low intensity exercise, it promotes blood flow, it aids in removal of the metabolic waste, it reduces muscle soreness, it improves the flexibility, it restores energy balance. This, like we said earlier, happens with slow jogging, with swimming, cycling, yoga, recreational game, etc. For example, in swimming, it is not that an athlete should go and do competitive swimming. He may swim as a recreation, or he may have a little slow jog, maybe jog with some of his colleagues, talking around when he is jogging, relaxes his mind also, or a recreational game. For example, a hockey player may play a small game of table tennis to relax him, to give him a different feel. Yoga, the asanas, the pranayams, everything will play an important role in active recovery process. So, for an active recovery to happen, it is important that you jog slowly, take it in relaxed manner, or play a nice little game, so that your mind is relaxed, your body is relaxed, and you are not exercising same muscle groups over and over again. Passive recovery, it reduces the muscle fatigue, the lactic acid built up, and the risk of overuse injuries. With a lactic acid built up, there is a risk of overuse injuries or a muscle cramp. So, a passive recovery process will help to understand how to decrease the muscle fatigue, how to decrease the muscle lactic acid built up, and how to hence reduce the risk of any overuse injuries. After intense exercise, when injured or overtraining, it is important that you do a passive recovery, because any injury, what you need is rest, and a good amount of rest. So, our intense exercise, rest is important. Very often you see sportsperson, athletes who are very overzealous, they want to play, they are very keen to get back to the field, but their importance is how to they give them a full rest and an appropriate recovery process. Passive recovery is essential for tissue repair, immune system support, mental rejuvenation. The body and the mind has to be in sync for an athlete to perform to the optimum. Only mental recovery or only physical recovery is not going to be of any purpose to the sports person who has to play the next game and who has to perform to his optimum. Hence, the equal importance of physical and mental rejuvenation, and of thus helping the tissue repair, helping the immune system, so that the body does not give up and the body and the mind both can continue playing to the optimum. Then is replenishing energy stores like glycogen. Once you are exercising, the energy stores are going to be depleted. How do you develop them? Is during recovery process. So, during recovery process, what you do is you replenish the energy sources, not just by rest. You have a diet, you also have a rehydration program, you have antioxidants, you have multivitamins, and you have all the aspects which will help to replenish the glycogen or energy stores. Then it promotes superior performance because of the good recovery process, and it allows the body to recover naturally. This will happen when you are sleeping. Again, sleeping means not playing on the mobile, sleeping means mobile in off mode, next to you, stop the mobile. 2 is relaxation, either through meditation or any other methods of relaxation as discussed above. 3 is a good massage meditation. 5 is a contrast bath, ice bath or hot water bath, and last is compression clothing. Compression clothing will help the peripheral blood flow go back to the heart. Then the third was the long term recovery process. It is used to prevent overtraining and burnout. Like I said earlier, a sports person may be overzealous, he wants to play, he wants to train, he wants to perform to his best, he wants to contribute to the team, he wants to contribute to winning. But he has to accept it, that how to prevent the burnout. You have seen so many Indian cricketers, Indian sportspersons taking rest nowadays. That is a scientific way of assuring that the sportsperson is going to last to his full potential. It helps the athlete to adapt to training stress and contribute to the peak performance. Physical training has a lot of stress, not just physical, psychological, emotional, etc. stress. These stresses are going to affect the athlete adversely. An athlete has to adapt to these training stresses, not just physical, not just psychological, not just emotional, not just of the soul, not just of the victory, not just of the defeat. But this is an important aspect of recovery which will happen during long-term recovery progress. If an athlete can contribute to that or can adapt to that, then it contributes to his better and to a performance to his peak. Rest and recovery has to be part of a seasonal training schedule. It cannot be today you are doing rest and recovery. It cannot be in this schedule you are doing it. The whole season, when it is planned, a rest and a recovery program is part of the seasonal training schedule, which every coach now is absolutely adapting to it and advocating it. How does one achieve long-term recovery program? One is rest. Two is active recovery massage. A good masseur understands this and helps the venous return. Two, stretching. Very important, because stretching, if you don't do stretching, if the athlete avoids or compromises on stretching, it can lead to muscle fatigue, it can lead to muscle tears, it can lead to muscle injuries. A good diet, depending upon the protein intake, upon the carbohydrate intake, upon the fat intake, healthy fats, a good diet will assist in recovery process. Hydration, which water to drink, how much water to drink, what is the temperature of the water to drink, when to drink the water, or whether to drink only water or isotonic drinks or hypertonic drinks. It is part of the process of the long-term recovery process. Compression garments, it helps you must understand this, helps the venous return. Breathing exercises, yoga has given us a great platform, yoga has given us a great benefit of pranayama, which all of us need to follow, especially the athletes need to follow, because pranayama is a great contributory factor to long-term recovery, to full-time recovery, to a good recovery, to a scientific recovery, to a recovery that will enable the player to play again. Then comes cryotherapy. Often we use ice baths or cold baths, etc. Then photobiomodulation and recreational sports. Like I said, a player playing a game of football or a soccer or a hockey or a marathon can go and play maybe a small swim, or maybe a small jog, or maybe a small game of table tennis, or maybe a small game where he is relaxed, but definitely he has to endure himself to recreational sports, because that helps the mind to recover or to relax from the main sport that is playing and concentrate on his recovery process. There is an important announcement here. The body adapts to the stress of exertion only during rest period and not during the exertion phase. So, for example, I will give you a small hint in this. When you are lifting weights, always when you are lifting weights, be careful. When you are lifting weights, you should inhale out, and you are relaxing the weight, you should inhale in. Second important hint is, when you are relaxing the weight, you should go slow, because that is the rest period in which the recovery is going to happen. That is the rest period when you are going to develop these muscles of yours and show off to the others that this is what I did during the gym exercise. So, I repeat, the body adapts to the stress of exertion only during rest period and not during the exertion phase. How to assess the recovery process? Is there a subjective method or an objective method? Yes, one is subjective pain assessment by the self. A person can himself say on a score of 10 how much is the pain levels. 2, a self report, that is an activity log or a daily diary that the athlete can write on his own. 3, like we discussed, the counter movement, jump performance, we will repeat the parameters. 4, heart rate recovery, like we discussed earlier. 5, orthostatic heart recovery. 6, the neuromuscular functions. 7, biomechanical or immunological assessment. Good quality and quantity of sleep, and the feel good factor. Both are very subjective. but it is an important part of to understand whether there is a recovery or not and to assess the recovery process. Like I said, we will repeat this. The counter movement jump performance for a trained male athlete is 24 to 28 inches and a trained male female athlete is 20 to 24 inches, and for an untrained male it is 16 to 20 inches and an untrained female it is 12 to 16 inches. Here we also add the heart rate recovery ideal is above 18 beats per minute and orthostatic heart rate is 7 to 10 beats per minute. A complete holistic recovery enabling the patient to match fit is not just of the body and mind. It includes psyche, feel good factor, emotions, competitive eagerness, hunger to win, zeal to perform to the optimum every playing moment. Every time the player is on the field playing, every minute, every moment there should be the hunger, there should be zeal that I want to perform to the optimum. Only then we can consider this recovery to be complete and holistic. Complete holistic recovery for the patient needs to have a good psyche, good feel good factor, emotions, competitive eagerness, hunger to win, zeal to perform and preparedness to give optimum performance. Homeopathy is the only science which mandatorily takes into consideration the psyche of the patient while arriving at a prescription. As a principle, the homeopathic approach and prescription is very individualistic. One must understand that while taking a case taking of any patient in homeopathy, you just do not take the consideration of the problem of the patient. The psyche is very important, the mind, the emotions, the likes, the dislikes, the attitudes, his mental makeup, his thermal reactions, etc. will play a major role in arriving at a homeopathic prescription, which is individualistic, which is curative, which gives a desired result and by which we can assure the patient, or actually if not assure the patient, we can be reassured that yes, we are on the right track to help the patient or help the athlete full scientific recovery in which he can play the next game and the next game and the next game to his optimum performance. Jai Hind.